Hello, I'm Dave Junkin. I'm one of the sports medicine specialists at Seaview Orthopaedics. Today we want to discuss the Regeneten Patch. The Regeneten implant is a bioinductive product. What that means is actually derived from bovine Achilles tendon. Yes, from a cow's Achilles tendon. There's no living cells, it is just the structure. Your body will recognize it as tendon material, and your own tendon cells will invade the tissue once it is secured and incorporate it and thicken up and heal your tendon. I'm seeing wonderful results, people getting back to activity levels much more quickly than they would with traditional repair techniques. The benefits of the Regeneten patch, we have seen faster recovery. As such, we can accelerate the physical therapy and have people begin using their shoulder very quickly, and many patients get back to full activity by 4 months after surgery. The use of the Regeneten patch is really on a patient-by-patient basis, really depending on the pathology that is presented. In most cases, I'm using it for partial thickness tears, but this can be used for augmentation, for larger tears. It cannot be used to replace any of the tendon, as it doesn't have the structural integrity of our tendon. It's more for augmentation. There are no risks involved in this implant in that it is, yes, it's a naturally derived source, but there's no concern of sensitivity, rejection, as there's no living cells within it. And the risk of infection is no greater than any implant we use. Following surgery, if you receive the Regeneten patch for your partial thickness tear, you'll receive a packet which has additional instructions on how to proceed. We want to get the shoulder moving as quickly as possible. You'll be in a sling, just as you would if you had a traditional repair. You'll be given a set of instructions to begin exercises that evening. As you progress through your post-operative period, you'll be giving more exercises to do. The goal is to have you back to full activity by about 4 months post-surgery. If there are any additional questions, that's when you can notify the office and we'll be happy to answer them. I'm now going to demonstrate how the Regeneten patch is inserted and secured to the rotator cuff. So when working, we're in the subacromial space, which is in between the ball and this bony roof here. So it is in this location where the Regeneten patch will be inserted. The Regeneten patch itself is quite small. It's only about the size of a postage stamp, and it's typically inserted in such a fashion to lie on the rotator cuff, just like that, to augment and repair the partial thickness tear. This area here would be the bony portion of the ball or the humerus, and this will be the insertion point. Then we place cannulas in. Typically we'd come in with the cannula in such a fashion as this. The Regeneten patch itself is delivered directly laterally. This is the Regeneten implant. It comes in a nice delivery system. It is rolled up like a cigar inside this delivery system. We insert it through a cannula through the lateral side of the shoulder. I release the trigger or safety device, pull the trigger, and it inserts out. And there it'll sit directly on the tendon, coming in at the angle, getting it in the position we want, piercing the Regeneten patch, and then squeezing. We'll hear click. And now that staple is secured, securing the patch to the rotator cuff. And then we would come in with another one, securing it as well. And now you can demonstrate and see that the implanted anchor, this is a peak anchor, has secured it to the bone laterally. An additional anchor may be placed back in this region as well, and any additional purple absorbable anchors can be placed to secure it. I've been using the Regeneten patch now for about 4.5 years in my practice. I am very happy with the results. If it's something you like to see if you are a candidate for this procedure, feel free to contact Seaview offices for an appointment.